to my cloud. So hi everyone, welcome to the Developing a Holistic Cancer Treatment Care Plan Masterclass. My name is Candace Elise Johnson. I have my very special guest, very special friend, Renee Van Heel with me, sister in Christ here. And I'll get into our introductions in just a minute. But I put together this masterclass, Renee and I put together this masterclass to be part of a series. I am so excited to dive into the world of holistic and alternative cancer treatment. It's very, very near and dear to my heart. I'm going to actually pop off the presentation in just a minute when I go through our introductions. But before I do that, and share with you why I'm so passionate about this. Michael's probably giggling in the background because he knows everything about this. Renee, you too. Is I want to share with you the journey that we're going to go on over the next hour to hour and 15 minutes together. Okay. So our first piece that we're going to go into is I'll get into some introductions. You might recognize these two ladies over here. They might look slightly familiar to you in some capacity for some of you that are here. Okay, I'll get into introductions in just a minute. So our first stop on this journey is going to be a treatment goal discernment. I'll share with you a few stats that I have pulled up. I'm excited to share those with you. I'm going to share with you some unpopular opinions that I have created that are floating around, okay? And my intention for this piece, the treatment goal discernment, is so that you and anyone that you know, whether you do not have cancer, whether someone you love has cancer, whether you are in remission, what's that look like? This is going to be a holistic view for everyone. Is like, okay, they just told me I had cancer, now what? Or you're in remission, now what? Shameless plug, we're going to be doing a masterclass called Okay, I'm in remission, now what? So stay tuned for that. I'll talk about that at the end. Okay, but this is for really a holistic view for everyone on, okay, what can I do? What can I possibly do now that I've heard this news? Okay. Our second stop on this journey, we're going to talk about required health optimizations. There are specific pieces of your health that are going to activate and trigger cancer cells to grow. I've pinpointed several of them. These are a high level overview. In my assessments and my consultations, we go pretty granular, visceral, we go cellular, and we can pinpoint other ones. But this is the high level view of what's going to affect the stress levels, the toxic levels, the cortisol levels in someone's bloodstream that could potentially elevate the growth of the cancer cells. Okay, so that's our second stop. Our third stop here is how to advocate for yourself. This was actually, thank you, Renee, for saying this in the beginning when we created this masterclass, is Candace, you have to talk about advocacy. Candace, you have to talk, okay, great, you give me this care plan. What do I do with it? My family doesn't want me to go alternative. My brother doesn't want me to go alternative, and I've lived with him my whole life. My husband, my wife doesn't want me to go alternative. My doctors are hounding chemo and surgery down my throat. What do I do, Candace? We're going to talk about that. And then this is my favorite part. We're going to go into evidence-based alternatives that work. I'm not going to stay on this screen very long because there's some fun pieces in there that I want to be a surprise. And we also are going to have Renee come in, and I'm just going to go ahead and get into introductions. So Renee and I met 5-ish years ago. Does that sound right? 6 years ago? Something like that?
Probably six. Yeah, probably
6? Okay. So about 6 years ago. And we had started I had started a Shackley business under someone who was under Renee. And in my experience, it was instant friendship. There were several things that Renee was very knowledgeable about, very wise about. And when I heard that she was a 2-time cancer survivor, no chemotherapy, no surgery, I thought this woman and I are going to be best friends because I was in the oncology industry for several years, and I'll get into that in a minute because I want to continue introducing Renee. She is a nutritionist, again, two-time breast cancer survivor. You guys, I just I could go on and on about that. I don't know if anyone who watches this recording or is here live knows how miraculous that is. When you have traditionally, when someone has breast cancer come back, that's when the doctor is going to say, absolutely no way. We've got to cut it out. We've got to do radiation. We've got to do X, Y, and Z. And they're going to hit it very hard. I know this very, very, very well from the work that I used to do in oncology clinics. So Renee is totally well versed in this. She is going to give us her expertise on products that are going to support you during the cancer journey, as well as how to clean up your house so that we lessen all of the toxins that are radiating around us in life that can cause cancer, proven to cause cancer. She's got some great statistics on that. Renee, before I introduce myself, do you have anything else that you would like to share about yourself?
No, just the biggest thing is the advocacy because I had to stand up against a just ruthless oncologists. And I mean, they were terrible, but I was pretty firm and I was lucky I had the support. So it's support system and advocacy. So I'm glad you're going to talk about that because it's not easy at all, but worth it.
No.
So worth it.
Yeah,
Yeah.
I myself have never gone through a cancer treatment journey. Uh, Michael, may I share a little bit of your story? I know
Yeah,
you
of
said your
course. Of
camera
course. I
isn't
don't know
working.
what my camera's just not working. It's the weirdest thing. I was
Oh,
just on it like just before this
oh,
call. So sorry.
okay.
I'm not sorry, but I'm disappointed.
Oh my goodness. Well, maybe it'll fix itself.
Yeah.
And Michael, I know you've been through a chemotherapy treatment journey, correct?
Yes. Yeah.
Yes, and surgery.
And surgery and chemo radiation surgery.
Okay. Do you mind sharing a little bit about your experience, what you felt with the physicians when making those decisions?
Well, it's hard to share just a little bit, but I will say that I was diagnosed with a brain tumor at 29. Um, and they gave me 2 years to live maximum. Um, and then, 11, a short story is 11 years later, the tumor got worse. And so when I got out of surgery, they said that I had 3 months to live. And I said, I don't think you're right. And during the time that between when I was 29 and 11 years later, they came out with a chemotherapy for me, sorry, my type of tumor. They didn't know if it was going to work. Um, and so it was not really a choice, but it took me out for a year, a little more than a year. And more. Like it was really devastating for my family and for, you know, for my life. It really today I can see myself swallowing a chemo pill, for example, like right now.
Wow.
Mhm.
Yeah, it doesn't leave you.
No, no.
And Michael, if you don't mind me asking or sharing
Sure.
with the audience, how many years post your first diagnosis out are you?
Um, Actually, this week is 32 years.
What?
Yes.
Oh my gosh, congratulations.
Well, Canada's a
That's
special
amazing.
place in my heart, so I'm glad I'm here.
Yep, yep.
This is so before I go, oh my goodness, I'm gonna tear up.
Yeah.
Um, Before I go into who I am, my introductions, what validates me to even be teaching a class like this, I want to share a personal story. So I am a registered nurse, a BSN. I got my BSN from Penn State. And interestingly enough, we won't go into this whole story because it's a a God moment that I could spend hours speaking about, a testimony before I knew it was the testimony. I got recruited into the oncology industry. I never, ever for a second thought that I would be there. I thought I was going to deliver babies my whole life. That was the thing, you know? And even before that, from the time I was 8 years old till the time that I was 18, 17, I thought that I was going to be a pediatric pulmonologist. I knew my whole life I needed to be in the medical industry. That was exactly what I'll say the Lord, I did before I knew it was the Lord, said, you're going to be in the medical industry. You're going to be in the medical industry. There is no other way. That's what I felt so convicted of when I was 8 years old. How many eight-year-olds say, I'm going to be a pediatric pulmonologist? This weirdo right here. And when I was in nursing school, I had an internship, and that internship consistently kept sending me over to the oncology wing. Hey, Candace, we've got this opportunity, we've got this opportunity. And then I was approached by several of the nurses that said, hey, Candace, do you have a job when you graduate your senior year? This is my summer, my junior summer going in to my senior year. Candace, do you have a job? I had a job offer before I entered my senior year to come work on the oncology industry. And I thought, what? The oncology? Okay, well, whatever. All right. Well, I'll play the field, you know? But I want to fast forward to a moment in time with someone that I'm going to call Bill. And Bill had recently adopted his granddaughter because his daughter was on drugs. And Bill and his wife were in and out of our oncology floor for about a year and a half. Chemo treatment, surgery, chemo treatment, surgery. His heart started failing. And this was around my second year or so in the oncology industry. And Bill came in. His name is not Bill, by the way, but I'm calling him Bill. Bill came in to our unit, and I just, I can recall it like it was yesterday, and I could just see him. He had the look. The chemo had done its damage. The surgery had done its damage. His heart was failing, and he was still trying to put on a happy face for his family members. And I was going to be his admitting nurse, which was great for me because I loved him and I loved his family. And I went into the room as soon as I got the orders back from the physician. And I looked at the orders, and it was the experimental chemo. I knew exactly what we were going to do, non-small cell lung cancer. So we're treating the cells of the lung, nothing to do with smoke, has everything to do with what Renee is going to go through, the toxins, the chemicals, the things that we're breathing in every single day that cause this cancer. Okay. And so I go in and I shut the door. I make sure no one follows me or can see me. My aide not coming in. And I looked at his wife and I looked at him. And all I could manage to say is, I could lose my job for saying this, but please don't do this. Please go home. Please don't do this. It's going to kill you. And then you're not going to watch your granddaughter grow up. I said, please don't do, there was the only thing that I could manage to keep saying was, please don't do this. So I left the room and I went to my charge nurse and I said, I refuse to give this treatment. And she said, it's required. The physician gave you these orders. I said, I want you to go look at that patient and look at those lab values, his white blood cells in the toilet, his heart failing, he's in pain, he's on massive amounts of pain medicine. And I said, I refuse. I'm not going to do it. It's on my license. I am a licensed medical professional, and I refuse to do this chemotherapy. I refuse to do it. So they took the case over and I got reassigned. I wasn't allowed to be his nurse anymore. The next day I get called into my manager's office. I'm told that I am going to be reprimanded and a mark is going to go on my record against me that I refuse to give the physician's orders. The physician said that the patient was well enough to receive these orders. And I said to my nurse manager, I said, did you go look at the patient? She said, yes, I looked at the patient. He's fine. I said, he's not fine. And I felt like I was screaming on the inside. What part of, do you even know these people? Do you even know what's going on in their life right now? He died 6 days later because his lungs filled up with fluid and he died on a ventilator bleeding out of his body.
Right.
Yeah.
And that's when, again, I was maybe 1.5, close to maybe even sooner than that, years into my nursing career. And I didn't plan on sharing this big, long story. I honestly thought we'd be in the presentation already, so I apologize for that. But this is why this matters. And ever since that day, by the way, that was sometime around 2011, I have been as loud as I possibly can about alternative and holistic research for cancer treatment against chemotherapy and surgery, because this is what people are standing up against. This is what our friends, our family members, Michael shared about it, Renee shared about it. This is what our friends and our family members are up against. Because the physicians that are in charge, they truly feel that it's the only way. So that goes into my first, and real quick, I'll lightning round my resume after this. I left my nursing career in 2020. I left as a clinical education director. So I had gone up and up and I did the management and I did all of those things. And a clinical education director sounds great. You know, it was a fun title, great money, great bonuses, etc. But it still felt like square peg, round hole, square peg, round hole. And every time I tried to speak and optimize things, no, Candace, you can't optimize things. They're fine the way they are. Don't just do your job. Just do your job. And I'm like, what is going on here? So I left. I got certified in emotional intelligence and personal development, transformational coaching. So I am a transformational emotional intelligence trainer and coach for adults and teenagers. And I do incorporate that with my patients. So over the last few years, I have worked with several hundred patients at this point in alternative and holistic cancer treatment, as well as emotional intelligence, stress relief. That's actually where I met Michael. We met in a personal development training together. So cool how we met there.
Mhm.
And that is what inspired me to finally start speaking out about this. So I want to jump right in because I know I've taken up a lot of time here that I hadn't planned on. The first piece, and I'll remind you, I'll quick share my screen. The first thing that we're going to be speaking about is, can you still see my screen?
Yes.
Oh, here we go. The first thing we're going to talk about is treatment goal discernment. I want to show you a few stats. I hope this comes up right away on my chat GPT. Nope. Okay, one second. Huh. Okay. Well, there we go. So I asked chat GPT the other day, GPT, I said, how many people die of chemotherapy related side effects each year? And ChatGPT reminded me that the exact number of deaths caused by chemotherapy related side effects is difficult to pinpoint because it based on these factors. Now, what we also know in the oncology research industry is when someone dies from a chemotherapy related injury, it's coded as a cancer related death because cancer is the primary diagnosis. So my friends, when we are looking for the data and the stats, how many people are dying from chemotherapy related injuries like heart failure, fluid overload like Bill that I shared with you, and there was another one, infection. Infection is the big one. We're not going to see the stats. I have spent hours trying to find the statistics. Now, what we will find, I'm going to go back to sharing my screen. What we will find is that, let me quick share screen. Here we go. What we will find is that I'm going to scroll down here because there's a lot of stuff in here I want to pick through for you. What we will find, and it's not showing you the information that I pulled up. That's okay. Thank you, technology. What we will find, I'm going to stop sharing because it didn't pull up what I wanted it to. What we do find is when you Google chemotherapy-related deaths. When you Google these statistics, what you will find, same information ChatGPT told you. And you're also going to see that the deaths will break into 3 different pieces. Number 1, disease progression. They say this is what they assume are the subsequent reasons someone dies. Reason number 1, this is by the NIH, I believe, did this study. This number 1, disease progression. Number 2, chemotherapy-related deaths. And number 3, infection, which is a chemotherapy-related injury. Our chemotherapy-related injuries, and I promise you I'm going to get to the treatment, the holistic treatment goal and getting into that, but I wanted to make sure that you heard the statistics first. Okay, we have, I'm going to pull it up on my phone because that's where I have the research. And then also go back to, oh wait, you can't see my screen. Okay. I had a bunch of other research pulled up for us, and technology is not working for me today. So I'm going to pull it up on my phone, okay? In the United States alone, these are based off of 2020 statistics, okay? 2020 statistics in 2020, are you ready for this? An estimated 9.3 million people died from cancer worldwide. In 2020, an estimated 9.3 million people, 9.3 million people died from cancer worldwide. In the United States alone, and I feel like this is on the low side, 604,570 people in 2020. Now I want you to look at this. If we know that the leading reason why someone dies from cancer is number 1, disease progression, and then number 2, infection or other chemotherapy related injuries, then you can surmise that a third of those people, which is close to, math is not my strong suit, so one moment, please.
200,000, 220,000.
Thank you for my math wizards on this call. Approximately anywhere, especially if the third reason is infection, we're looking at anywhere between 200 and 400,000 people that are dying every single year from chemotherapy-related injuries. That is what I'm gathering from this data.
Wow.
Okay. Now, I want to get into the treatment goal discernment. Very, very, very important when you're talking to your patients, when you're talking to your, I know many of you own and operate wellness and nutrition businesses. This is going to be very important. Is number 1 unpopular opinion that I have, quality of life must matter more than a cure. I'm going to say that again. Quality of life must matter more than a cure. The reason why is because a physician will only try to treat a presumptive cure or a debulking of the cancer. They're not going to treat a quality of life goal for your loved one. Meaning, we have no idea what pain threshold your loved one or yourself is willing to be in before they're going to call it quits. We have no idea how much infection they're willing to have, how much weight they're willing to lose. My aunt died last year weighing 90 pounds, bleeding out of her body because the doctor sold her on chemotherapy that it would debulk her cancer. You know what I told her? I said, don't do it. You're going to die. Don't do it. You're going to die. There are other options. Let me help you. She didn't want to hear it. Which comes to my next second opinion, that second unpopular opinion that you are going to hear from your loved ones, and that's, I'm just ready to fight it. I'm going to fight this cancer. How many, show of hands, alive here, how many of you have heard, I'm going to put in the fight. Let's fight like a woman. Let's fight. Okay. If you're gearing for a fight, you're already set up to lose. If you're gearing for a fight, you're already set up to lose. I'm going to say that again. If you're gearing up for a fight, you're already set up to lose. Our Heavenly Father says, I go before you in front of thy enemies. I'm going to just bring a little Jesus up in here. It's okay if that is not your center of belief. It's mine, but I'm just going to go ahead and say it. Whatever your belief is, I do not for a second believe that there should be any fighting happening at all. We don't have to fight. We can create a care plan that looks at a holistic view of our loved one so that they feel supported and that this is a journey that they have the best results emotionally, physically, spiritually, sexually, financially, communitily. That's not a word, but I just created it, that they've ever wanted. These adult programs that are out there that are like Last Wish programs. I know the pediatric version is Make-A-Wish Foundation. There is a couple of adult options that are not so big. They could definitely use some support. Maybe once this takes off, that's where all of my extra funds will fund. We'll fund one that actually does things for adults. But anyway, why give someone a death diagnosis? Why wait till that point where we're helping people fight something before we're going to help them with a quality of life goal? Oh, let's make sure you get to Disney. Let's get you to Niagara Falls. Let's make sure you get to Costa Rica. Well, why are we focusing on that as the main treatment plan? Am I going to sit here for the next year and a half watching my loved one die from pain? It's horrendous. I have seen with Renee's specific type of breast cancer, because I've talked about it specifically with her, I know how much pain she would be in to this day, having the chemotherapy treatment, the radiation that they would have wanted her to have. She would have still been in pain to this day. She may still have chemotherapy brain, and could, regardless of how great the supplements and things that she's going to talk about are, I know that there would still be appetite issues, gut issues, problems digesting, chemo brain, and pain. I know this. How do I know this? I spent not just 3.5 years in a bone marrow bone marrow stem cell transplant level 1 trauma center where we were also a Penn State Cancer Institute, if you know anything about the North. We are one of the leading cancer institutes in America, next to MD Anderson and Hopkins. We did a lot of their pilot programs, a lot of their test chemotherapies, and we created our own. We were seeing the worst of the worst of the worst. And then I ran a chemotherapy clinic privately with a doctor who brought me out of the infusion clinic, who said, hey, my patients rave about you. I want to start my own clinic. Come work for me. And then I got fired a year and a half after working for him. He said, you know, Candace, I just don't think cancer is for you. And I was like, what? Okay. What? I had no idea what to do with that except for the fact that I didn't feel he knew what I didn't know, which is this wasn't how I wanted my patients to show up every single day in the clinic, fighting all of these. We had breast cancer patients, testicular patients that are going through stage 3, stage 4. We had our blood cancer patients that were going through several rounds of chemotherapy, and we were seeing them year after year after year, treating their diabetes because of the cancer, treating their renal failure. They're on dialysis now because the chemotherapy screwed up their kidneys and they're not a candidate for chemotherapy because they're stage 4 cancer. So we're not going to give you any kidneys. We're just going to shoot you up with drugs all day. And I know that I get a little passionate about that, get a little bit long-winded, but it's just, you can't unsee what I've seen. And so I say this and I make this part in the beginning a little bit bulky because this is what our patients, this is what our families are going to go through. Okay, I'm gonna pause. I normally would ask for questions in between each section and answer a couple, but for the sake of time, I am gonna move right on through, okay? Is everyone okay with that?
Sounds good.
Okay, awesome. Required health optimizations. Very, very specific. And again, this is a very high level overview. Renee and I are going to be hosting a series of these presentations where I'm going to go into each of these pieces a little bit more so that you have more support for your family members and your loved ones. I want to talk about each of these. I'm not going to go through them. I am going to go through them very quickly. Renee, you'll be my timekeeper. Okay. Give me 5 minutes on the clock. Give me 5 minutes on the clock to wrap this one up. Okay. I bet
All
you I
right.
could do it in 3. All right. I want to start with some science because I'm a big, what do you call me, Renee? I'm a big geek.
She's a geek. She is a science geek, but thank goodness she is because I am not. So that's why I hang out with her. So yes, it works well.
Yes, so I do frequently spend my time until like 11 to 1 a.m. researching for my patients and my clients because I love getting into the data. I love finding what's out there, and I love seeing what's actually being studied in other countries as well as some very rarely here in America. Okay, the first thing that I want to talk about is a cell. Everyone have an idea of what a cell looks like?
Hmm.
Okay.
Yeah.
Essentially a cell. There's a bunch of little stuff that's floating around in the cell that starts to do weird things. That's what I'm going to say. When stress happens in the body, many of you already know this because you have nutrition businesses. Okay, and many of you know this because I know a lot of people watching the recording are also health enthusiasts. They've been in this industry for a long time. So what happens is data inside of that cell, when stress happens over and over and over again, the cell starts to say, well, I need to hurry up and make more cells because I'm stressed. I need to figure this out. So it starts to kind of skip some steps. But what happens when we skip some steps is there's some extra kind of, let's call it rogue data floating around in the cell. Okay. And then the cell says, I don't need this rogue data. I'm going to throw it out. I need to throw it out with the bathwater. Okay. This creates elevated toxin levels in our bodies, what we would also call lactic acid and cortisol, amongst other things that I'm not going to get into right now. And that creates an elevated acidic level in our bodies when we have stress, emotional stress, physical stress, sexual stress, financial stress, and if you don't have any community support, also physical stress. Did I already say that? I don't know if I already said that. I'm not looking at my slides, I'm looking at you. I put emotional support when you get the slides for your take home. You'll see emotional support at first. I have yet to find the data. I'm going to repeat myself. I have yet to find the data, but I am very clear that it's going to eventually come out at some point that emotional stress is one of the highest causes of cancer. It's not smoking. It's not, and I know we're going to talk about cleaning products in a minute. It's not cleaning products. I guarantee you it's emotional stress, unprocessed sexual trauma from the past, unprocessed trauma in marriages, unprocessed trauma from one of my patients was, as I found out, one of my patients, she had not recovered from her mom dying several years prior. It's unpacked. One of my other patients, her daughter came to me to help me treat her mom. In fact, I have worked more with the daughter than I have with the mom because the daughter had so much stress of taking on this burden of her mom, feeling like she was pulled this way and that way. What's the research look like? How do I do this? That's where the emotional support comes in. When you have your caregivers also adding to the fear, the pain, watching you go through this, then the patient also takes on that stress. I call it compounding interest, except it's not working in our favor like it would financially. It's like interest. Like you don't pay the credit card bill, it eventually bites you. Okay. Our other things that I want to quickly go through because I'm seeing my timer here. Spiritual health. Real quick, shameless plug for Jesus. The Lord says when I'm just gonna, just let me see if I can just flip through this real quick, just because it's right in front of me.
So Candace, while you do that, I'm going to tell my story on the stress. Because
Please.
when our
Please
house
do.
burned down in the wildfires in San Diego in 2007, we had a counselor come in and speak to us. And she said, I am here to help you guys relieve your stress. We were able to get a grant from United Way, so we all got counseling. She goes, it is a proven fact that your cancer, once you hit a really high stress point within 3 years, that's when cancer shows up. So she worked with us all on meditation, on accepting what's going on, the whole thing, because she also said that is the number one cause of cancer is the stress, the emotional stress. So it was funny because we did start to see in 3 years down the road, we did start to see a lot of our fellow fire survivors come down with cancer. It was 100% true.
Thank you for sharing that.
Mm.
Oh my gosh, I could piggyback on that and spend an entire hour on that. So, regardless of your spiritual beliefs, having something that is outside of you that has your attention, has your love, ideally, it is the creator of all things. Having something that is bigger than you helps that focus out. Because if we're constantly focusing in, that's where we add an even deeper layer of the stress. So, again, shameless plug for the Bible, Deuteronomy chapter 7, verse 15. Deuteronomy chapter 7, verse 15. And the Lord will take away from thee all sickness, and will put none of the evil diseases of Egypt, which thou knowest, upon thee, but will lay them upon all that hate thee. The illnesses, again, regardless of your belief, the plagues that attacked Egypt, when you translate the words of the plagues, was cancer. When you translate the words back into Hebrew, don't even get me started. I'm going to do a Bible study on this, okay? Is cancer. Cancerous boils. That's what was given to Egypt. Now, if we have scripture saying that that's possible, the higher power, having some type of spiritual support that's trustworthy, is going to support your family members. Okay. Financial support, I feel like that goes without question. One of my questions in my consultations is to understand I don't care how much money you have. I have worked with people from multimillionaires to people who are like borderline homeless. I don't care how much money you have or you don't have, there is financial stress coming from somewhere. And I just got to pinpoint it. The financial stress could be, well, do I need to liquidate X, Y, and Z to do X, Y, and Z? What's that look like? There's community support that is out there for you, and we must have an adequate assessment of that. Your physician's not going to do that. A physician's not going to do a spiritual assessment. A physician's not going to do a financial assessment. They're not going to do a nutritional assessment, and they're barely doing the minimum for the community needs. So, as far as the nutritional piece goes and some other things that we can work on in our homes that are going to support us, I'm going to take a quick intermission and let Renee step in. She's going to share a few things about your home as well as the nutritional aspect. That is her wheelhouse. And take it away, Renee.
All right. Well, I do have a bit of a PowerPoint because that's how I stay on track. Because I get very, very emotional and tangled. And I have to, I do want to share, part of my story with my cancer because I actually, oh, hold on. It's not going to show right. So, but I actually had a friend that died of cancer, a really bad and really, really bad. She was 45 and came down with cancer. And I watched her die because of chemotherapy. And she made me promise, not just once, but at least a dozen times. She goes, Renee, if you ever get cancer, you have to promise me that you will do everything in your power not to have chemo and radiation. So she was a big factor for me because I saw her go from the most healthy, never been sick, within 6 months of doing chemo and radiation, dying of 80 pounds, you know, and that's when it just affected me so much. And it was before I was actually even introduced to the nutrition industry. So it's just amazing how certain things will happen in your life to put the path, you know, and Jess just introduced me to a gentleman whose mom has cancer. I mean, I love the serendipity, how if we all didn't know each other and how we all came into each other's lives, we couldn't be helping these people. So I'm very excited about it. And again, you know, I want to go through and share. Now I am having a little bit of technical difficulty. Just what I learned about the chemicals in my house. And are you seeing my screen? Okay.
Yes.
Okay. So I actually started learning about harmful chemicals when my oldest son was born with severe arthritis. So I started, and then with him, that's then came along with my cancer. So as I really started looking at what are these chemicals doing to us, why is his inflammation so high at such a young age? Why do I have psoriasis? Why did I, get my cancer? So I really started digging in, and I can say I'm a geek on cleaning products and chemicals, Candace. That I can say, but I like to bring awareness to people. I'm not going to go through bullet points. I always just like to put it out there. And this is where an overview, but we will have direct consultations if needed. But I am telling you, I had such bad psoriasis that the scabs were going up my neck. And it was all from my cleaning products, all from my home, my shampoos and everything. And I have resources that I can send to you that talks about all of these, but it literally, these connect to cancer. And when you look at the ingredients that are in some of these products, I mean, Johnson's baby shampoo has formaldehyde in it. And kids brain tumors are up 40%. I mean, come on, formaldehyde at 100%, leading to mutations that increase the risk of cancer, 100% Rexa cells. So, I have a whole presentation, a half-hour presentation just called Healthy Home. So again, I get very, very passionate about it. So my journey, I want to take you a little bit on my journey because I tried so hard to go green, and every time I did, I got kicked back. Because I started with Simple Green. Do you know how many chemicals are in Simple Green? Ridiculous.
My
And
dad cleaned with, real quick, I want to interrupt
yeah,
you.
please do.
My dad used Simple Green outside in his work. He went blind for 2.5 weeks and had to wear these patches. They told us they weren't sure if his vision was ever going to come back. I'm never going to forget it. I'm never going to forget it. He's thank the Lord, can see now just fine, but
I'm going to use that story because Simple Green is the worst. The worst. That's amazing. And I tried like 3 other, store-bought that had the word green in it because I didn't understand where to go, how to research it. And that's where we come in play. There is actually a link that the government has that you can put a chemical in and it's going to tell you what it does. But I do it in my presentation. I'm here to cut your time down on research. So and then I went to 7th generation, didn't work at all, and it's super expensive. Myers is probably the closest to what you can have as green, but it still is not completely green. Most of them don't work, and a lot of them, like you can see, is super, super expensive. So what was my solution? Someone introduced me to Shackley products. They have a whole get clean regimen from laundry where, I mean, literally no chemicals. There is nothing out there that beats what they have, and it's very economical. So it is 100% green. We actually have certifications from the EPA, and they talk about no harsh chemicals or VOCs, you guys, and that is really, really important. So people don't understand, a VOC is a volatile organic compound. And when it is let out in the open, air gets to it and it's mixed with other ones, it's deadly. And I don't know, there was a fast food restaurant that 2 people died because of the combinations they put in the stuff to clean the floors. So everything Shackley has is biodegradable. We do have the non-toxic certification, but it doesn't have phosphates, chlorine, ammonia, and clean should not have a smell. And I tell people that, well, I really like, I have somebody whose son has a severe autoimmune, and she will not stop using Gain laundry soap. Do you know what that does to your brain when you're sleeping on the sheets and he's breathing that in, and his clothes, he's wearing it in? It's 8 seconds for those chemicals to come into your body. Very, very, very much those toxins are carcinogenic. So this is just one product that Shackley has. It's called Basic H. It replaces your all-purpose, your windows and degreasers. Okay, it's $13 retail. That's it. And one bottle of Basic H will make 5,824 bottles of Windex. Okay, so again, that's the other thing. I wanted to go green, and usually if you're going to go green, everything's more expensive. Well, not with Shackley. They've been around since, this cleaning product has been around since 1960. And I found out through one of my clients in San Diego, she used to work for NASA. When she was 16, she would clean the cafeteria, and she used Basic H, she told me. So when she started her cleaning business, she said nothing but Shackley products. So NASA uses it, the White House uses it because it actually works. That was the biggest thing that my husband was just adamant about. I'm tired of you trying all these products. And until someone introduced us to Shackley. So again, I'm here to geek out on that, to let you know that we can cut so many hours out of your research to lead you in the right direction. But I'm like Candace. Candace, I like what you said at the beginning. Do your research, but let us help you with it, because to start from scratch, it takes a lot, but we've done a lot of it. Okay, the other thing I'm massively passionate about is when you are taking a supplement, it's got to be quality supplement. So I want to educate you. There's basically 3 types of vitamins out there. So the first type is a synthetic vitamin. It's where you get in the drugstore. Okay, I always tell people, if they have a multivitamin, take apple cider vinegar, drop it in, and see how long it takes to dissolve. I actually have a link that I can send you of a little test thing my kids did in our kitchen, and it's crazy insane. Men's GNC, after 24 hours, it still was not dissolved. So I'm super happy to share it. But you guys, a synthetic vitamin, they have those binders in it. You know, they don't have live enzymes. So it's not healing your body to work on its own. And that's what needs to be done. They have artificial colors. It's basically fake food. But the biggest thing that caught me.
And you pee it out. You pee about 93% of it all out, regardless of what it, just real quick.
Yes, please.
What you see on the back. Oh, 100,000% of your daily blah, blah, blah. Okay, we'll take about 93% of that, and that's probably what you're receiving. That's a proven fact with what Renee is sharing right now.
Yep. Well, and look at the orange one in the upper right, coating, which is majority of time shellac. Okay. Anybody know what decoupage is? In school, we used to take a piece of wood, glue a picture on it, and we would shellac it. So it puts a coating on it. Well, my husband, who is 64, his mom just sent him his from kindergarten, and the shellac is 100% in place. And that's the coating on the vitamins, you guys. So I always talk about, really understand the differences. So the second one is your natural vitamins, and they mainly come from health food stores. So that's one up from the store-bought. But again, what I learned from my son with arthritis. I gave him a vitamin that said all natural. Well, I found out only 10% of it was natural, and legally they can say that. So all natural means nothing, because you don't know what's literally all natural. It only has to be one ingredient that's natural. And I've seen that in house cleaners where they will say all natural, and I'll research it, and it's one ingredient is natural and the rest is all your chemicals. So, but again, you guys research the difference in these vitamins, because chemical and heat extraction, it destroys the enzymes. And that's what the majority of these vitamins in these health food stores are. And a lot of them in the health food store are white label, where a lot of your multivitamins are the exact same vitamin. They just slap another label on it. So again, the coating is shellac, very imbalanced. They skimp on the doses and the ingredients. So it's partial food. So I always tell people, well, I'm just happy you're taking something, but let me educate you that there is really, really a difference. So then this is when I finally learned that the best supplement, if you're going to take one, you might as well take a really good one, is pharmaceutical grade, a whole food supplement. It has the live enzymes. So instead of peeing out, what did you say, 90 some percent, you're absorbing 90 some percent. And it's actually there to repair your body so that you don't have to continue to be sick. And when I had cancer, I went on a very strict regimen of supplements and food. And it was just amazing because I knew I was getting the live enzymes, high quality raw material. You guys, it feeds and improves cell health. And that's what you want to do. You want to find the supplements. And this is where Candace comes in. She looks at your blood work and she says, okay, you're over on this, you're under on this, let's increase this. And she is an expert at it. I should say that is her best geeking out ever. Just start talking blood. And I'm like, okay, I'm good. I'm good. I do this to her. Okay, too much information, because she loves it. But that's why you want to have somebody like her look at your blood work so you know that it's being done. And again, what we ended up doing, we went with the Shackley supplements. That's one of our main vendors. We have a couple vendors for a couple other things like a metals detox or so we do use other vendors, but Shackley is guaranteed purity. It's clinically proven, and that's what you want. You want to know that it's pharmaceutical grade, and this is why I chose Shackley. My son was supposed to be in a wheelchair by age 11. They had him on such high medication at age 5, and that's when I started learning advocacy, because they just gave up on him. And so I started asking more questions, and I started saying, okay, there's got to be something better. And I'll tell you, he was on Shackley within 6 months. He was riding his bike, and he was like 6 years old when we finally found Shackley. So I know it worked for him. So then when I got sick, I went, okay, I've got to trust it now for myself. And it's hard, you guys. It's scary. It was probably the scariest thing I ever did, to make that decision to stand up to my oncologist. He was that far from my face, and he says, I'll see you on your deathbed. He was nasty to me, and he wouldn't answer my questions. And, they come on like they're insulted that you ask them questions. And it's like, you have no right to treat me like that. And this is where I'm excited to teach that advocacy. But when you are looking for any type of supplements, and right now protein is a big thing out there, there's so much bad protein out there. We have studies after studies that I can send you of all the different proteins. There's proteins being recalled because they have mercury in it. So I just want to encourage you, ask questions, but do your homework. Candace she sent me something about our Corrado Max the other day. Well, why does it have this ingredient? And I responded. So you're going to have questions, please. There's never a bad question. So, but you need to find a company that also has clinical research. We have UC Berkeley School of Health doing our studies. We are beyond organic. Shackley is the only company that tests the ingredients when it's picked for pesticides and contaminants, and then they test it once it's made. You will never find a company that does that. And we've had no recalls. Everything's 100% guaranteed. So, and that's the same with Shackley's cleaning products. They say, what do you have to lose? Try them. And I actually have a trade out buyback program where I will take all your crappy vitamins and let you choose some Shackley supplements for replacement if you promise to throw it out. Because we are all frugal. I kept a 99-cent bottle of Windex because I didn't want to throw it out. And I do want to show you. Okay, I do have, and I can send it to you. We have a usage guide for just the basic H for what it costs and everything. So, and it can be used to bathe your dog, clean your car. But the biggest thing is it has no chemicals. And I had one person get rid of 8 different cleaning products just with basic H. So these are some of the resources I used. You can contact Candace. And I love that it's resources. One of the big ones, you guys, is the American Lung Association, that I got a lot of this information. Shackley has a ton of information, but I like to go to outside sources, and they are really big on the VOCs and the different cleaning products. So with that, Candace, I am going to send it back to you, and I look forward to when we can dig in and do specific webinars for this. So thanks.
You're welcome. Thank you, Renee. Thank you. And a couple shameless plugs and friends, if you're here live, we are going to go a little bit over tonight. I got a little long-winded in the introduction section. How are we not surprised? Nobody, if you know me, you're not surprised. So we are going to go a little bit over. I understand if you need to leave early, we will have the Q&R section, questions and response. So if you do need to leave early, I totally understand. Please drop me privately your questions so that I can answer them live. Okay. Please drop me those questions, especially if you have questions for one of your patients, one of your clients. Okay. So I want to jump right into the next piece. And actually, I'd like to advocate for Shackley cleaning. I remember, Renee, when I told you that I ran out of, I don't know if you remember this, but I'll never forget it. I was in San Diego and I ran out of um a windshield wiper fluid. And I needed windshield wiper fluid. And I thought, well, Shackley cleaner cleans glass, right? So I could just put Shackley. I'm not even kidding you. I made Shackley glass cleaner for my windshield. I'm gonna tell you what, I had the cleanest windshield, and I've never had to buy cleaning products from a windshield.
Yeah.
And you're gonna breathe it in through your air conditioning. You're gonna breathe it in through the heat. So I'd much rather, and by the way, just it works just the same.
And it's only 2 drops of basic H that goes into the whole thing.
Mm-hmm.
So
So good. So good. So, and also, I just want to also point out, I love how Renee pinpointed the quality of the supplement matters, because here's what I want to get back on the train of this presentation is your physician does not treat the entire body from the nutrition standpoint. They treat deficiencies. I'm going to say that the majority of physicians, I can't say all because I haven't met them all, but what I will say is the majority of physicians that I have worked with, the majority of the oncologists and the hematologists, they're going to treat your deficiencies. And occasionally they're going to be proactive and treat the deficiencies that could happen when you have chemotherapy. So your vitamin D could go down. We want to make sure that you're on something like that. Hey, we want to make sure X, Y, and Z. We know it's going to go down when you have radiation. We know it's going to go down when you have chemotherapy. So we're going to put you on that. And the problem with that is, as Renee mentioned, it is created in the lab and you're going to pee it out. We're not actually seeing that. And what do we end up doing in the hospital? Infusing you with all of those artificial chemical supplements. So I want to jump right. That was my shameless plug for nutrition. I could go down the rabbit hole about labs and nutrition and clearly, actually, you know what? Renee, thank you for that. I'm going to add that to our list. Nutrition and labs.
well, it's vital, Candace, because what you taught me, it's where we have to start. Like I was magnesium deficient. I didn't know that. I was feeling fine and I was taking too much calcium. So I quit taking my calcium and added magnesium, but the blood work doesn't lie. It just
The
doesn't.
the blood work doesn't lie. And we also have to look at absorption levels, which are the things I'm going to look at in your lab work. I want to see, okay, well, what do we need to balance out? We need a little bit more of this so that your body's actually absorbing it. We need to add this. I'm not going to get into that. That's not this masterclass, but I want to geek out on it. I want to get into advocacy. So advocacy for your family members is very, very, very important. I'm going to touch on this very high level for the sake of time, because I do have questions that have been sent in for those who couldn't make it to the class, and I want to answer them live so that you have that on the master class or the recording. Advocacy is very important because it's easy now that we have a quality of life goal, that it's, what, I want to make it to my 20th year high school reunion. I want to make it to my 50th high school reunion. I want to go on a cruise. I've never been on a cruise. I'm saying several different things that I have heard from patients. I want to get married. I want to watch my daughter walk down the aisle. These are quality of life goals that your physician is not, I guarantee you, not a single physician out there will actually address these quality of life goals. And when we come at it with a physician, we do need, by the way, we do need some type of physician who has experience handling your specific cancer. We do want that medical professional on board. I am not a doctor, nor am I a nurse practitioner. So my education stops at a certain level, but it also accelerates in other places that these other physicians haven't. So advocacy is very, very important, because the people that you're working with, 9 times out of 10, are not going to have a holistic overview of your quality of life, the pain that you're willing to go through, the amount of infection, the amount of money you're willing to spend on hospital visits, etc. I could truly go on and on here. So having a professional like myself by your side the entire time, okay, you're going to go meet with Dr. Steve. Here's the things that we need to have in order. Okay, great. We have the family mediation appointment coming up. I do those. I facilitate family mediation. Okay, you don't have to be the one that does it alone. You do not have to do this alone and say, you know what, family, I would much rather have 6 amazing months of life where I'm going on that cruise, I'm liquidating everything, and we're selling the house, and we're going to travel the world. We're going to do it. I would rather have six months than a year and a half on chemotherapy. Do you hear what I'm saying? That year and a half could be horrifically painful, spent in the hospital, medical bills that your family's going to have to take over when you pass away. And the long-term side effects that I was mentioning had, in the example when I mentioned, had Renee gone through the cancer treatment that they were recommending for her. I always use this example when I'm teaching this. Does anybody, you may remember there was a Queen Latifah movie that came out, gosh, I guess it was like 20 years now. It's called The Holiday. And she was told, right? She was told that she had a brain tumor and that she was going to die in like 6 months. Woman liquidated everything and took herself to all these bougie restaurants, dressed up real fancy. She'd never done any of those things. She never left her house. She lived her entire life. And at the end of this period of time where she did everything she'd always wanted, she started talking to major chefs. She'd always wanted to open up a restaurant. They contacted her and said, by the way, we misdiagnosed you. You don't have a brain tumor. And you know what? Her entire life was changed. She met the man of her dreams. And I know this is a Hollywood movie, but I love that example because I truly know that that's what's possible when you have someone in your corner, like myself, a professional that has seen the worst of the worst and seen the best of the best in your corner, in your side, supporting you and your family members. And also, I know that watching the recording, I have several family members who are here watching this to advocate for your families to have a holistic alternative treatment approach. This is the same thing. You want to go in, you want to have that conversation with your loved one. That's also what having me on board looking at the entire scope is for. I want to go into the next piece here, evidence-based alternatives that work. Evidence-based, I'm going to whiz through this because I know that where we're at with time, because I could just spend 30 minutes on this. I am going to share my screen because there are some very specific key research points that I want to share. Second here. Okay. Can everyone see my screen?
Yes.
Okay,
So
can you see?
Candace, I just want to
Yes,
add one thing on the advocacy side, just a
please.
tip. You guys, when you go to the doctor or a family member or a parent, have them record the session with the doctor.
Yes,
So
thank
then
you.
all family members can be on the same page. And also, you're only hearing a quarter of what the doctor's saying when you first go in because it is traumatic to find out you have cancer. So please pass it on to everybody you know to just ask permission, say, I'd like to record this because I want other family members to know what we have going on. Then you can come back and dissect what they said. And then that's how the best way to become your own advocate.
Yes. And I want to piggyback on that. Don't take no for an answer. I just a quick caveat on that. Do not ask for permission. You do not
That's
need permission to record your doctor's words. Absolutely. And if your doctor refuses to have your holistic health practitioner on board or even in the clinic, I have gone to doctor's appointments. I have gone into patients' rooms and stood on behalf in between the family member patient that's in bed crying hysterically because the physician is trying to give care. Now, I can't do that for everyone, right? Because I that requires flying, that requires other things. I have done that. However, there are other ways around that. That absolutely is your choice. Evidence-based alternatives that work. If you take anything home from this slide, it's thermograms and MRIs for scans over PET scans and mammograms. I know that was a lot of grams and ams that I just said, and I'm gonna repeat that. So in normal scans for treatment are PET scans and mammograms and CT scans. Now, the amount of radiation from a PET scan and a CT scan is about this much, 25 MSV. At 100 MSV, you start to have minimal risks for cancer. Now, many of my patients, especially my advanced thyroid patients, my breast cancer patients, they have a minimum scan, CT scan, PET scan, every 3 months. That's 4 scans a year, if not more. That's approximately right at that point for increased risk for cancer. So that's interesting. So we're scanning you every 2 to 3 months. That puts you in the realm of increased risk for cancer, but you have cancer? Yeah, no. Same thing here. Let's look at, okay, you're in remission. You're getting 2 scans a year every 6 months for 3 years post-treatment. That equals approximately 150. Now we're going up and over that view. Now let's look at something else here. Average breast cancer treatment. This would have been you, Renee. I know this looks fancy. We're going to go into this. Again, here is our main point. At 100, you start on a low risk for cancer. At 1,000 MSV, we're looking at a significantly high risk for cancer. An average breast cancer treatment is 45,000 MSV. That's 44,000 MSV over the high risk for cancer. And that radiation blows up all over your body, and you basically remain radiating. People can't come near you. Your daughter, your son, they can't come near you. No, not for up to 6 days after your treatment because you are radioactive. You are giving them radiation. This is why I say to my patients, thermograms and MRIs for scans. Yes, you will probably have to pay for them out of pocket, but it's no different than a quality supplement. Do we want to add to our 401ks and our IRAs and our life insurance policies? Do we want to do that now, or do we want to wait until we're dying and our family's going to have all of our bills when we die? What's the option that we want to take here? The thermogram actually is creating some big waves right now. Several holistic oncologists are advocating for thermograms, full body MRIs. I can give you links to this, advocating for it while the FDA is still telling you that is not proven, not good, don't get it. Absolutely go for the mammogram, absolutely go for the PET scan. They're leading. Well, they can't make money from a thermogram. They can make plenty of money from the scans that they've been doing forever. Quick overview, propolis and red light therapy is shown and proven to stop cancer cells from growing and accelerates cancer cell death. Similar here with anti-inflammatory. Anti-inflammatory is when Renee was speaking about the cleaning products, it creates an inflammatory process. Same thing with the stress that I was sharing. CBD and THCA. THCA has the psychoactive component eliminated from the product itself. So you're getting the benefits. Again, not going to go into that. We'll save that for the consultation. But this is one of our key anti-inflammatory treatments. I can tell you miracles that I've seen these work. Talk about patients who have been tube fed through lines in their chest, said they would never eat, walk again, now eating and walking, all because of just this here. And quercetin also, which I didn't put on here because I mean, I'll geek. And so I wanted to do this, as Renee tells me. I wanted to put it on a timer. Other treatments that are very big, you can look up Hope for Cancer. Love that doctor that's based out of Mexico. Specializes in oxygen therapy treatments, hyperbaric chamber, which is a form of oxygen therapy treatment, ozone therapy treatment. And now I want to give you this warning. You'll see number 5 here. Candace, what does the warning on research articles have to do? And I'll tell you what the warning on research articles has to do is when I started this research, when I first started working with patients and clients in this realm, very easy to find alternative treatment, data, statistics, analysis, very easy for my geeky brain to find my numbers. It is, I mean, it takes hours upon hours. And now thankfully ChatGPT is helping me a little bit with that because the FDA, hopefully Bobby Kennedy does something about it, has buried all of the alternative articles in favor of pharmaceuticals. And what's devastating about that is the physicians are on board with it, as well as our family members. The people that we love are so bought into the fact that as soon as you Google, the first 4 pages says, no, that's not going to work. Propolis therapy and red light therapy, no, that's not going to work. You got to get your mammogram. You got to do this. It takes a very, just like the Bible says, it takes the eyes to see and the ears to hear to find exactly what we're looking for. So the warning on research articles is when you go to find these things, be diligent, be patient, keep looking for them, come to me. I have got literally spreadsheets of articles that I can send you on specific targeted therapy for specific, even rare kinds of cancer. Please advocate for yourself and your family members when you do this research. Be patient, be strong, and of good courage, and you will find it. You will find it. All right. Let's wrap it up here. How do you get a hold of me? How do you get a hold of Renee? What are our next steps? What's that look like? So for my patients, I do a 30-minute free consultation. You're going to get this slide given to you after the masterclass, okay? Free 30-minute consultation for everyone. We're not going to specifically go into labs. We're going to go at a high-level overview, and you are going to leave with a very abbreviated care plan to get you started. Okay, a full assessment and care plan creation. I'm going to review your scans, your labs, your medical doctor's notes, and evidence-based alternatives, care plan, education, and creation for you and your family, emotional support, family mediation coaching, as well as nutritional and stress support. That is going to be $189 plus processing. And again, Candace Elise Johnson, we're always going to start at the 30-minute consult. I've had many patients say, Candace, can we just start at can I just have the whole thing? I want the whole thing. I want all of that. What is that? And I say, no, you know what? I thank you. And again, I want you to know that this is absolutely the route that you want to go. I want you to have that taste, that test, and say, okay, yeah, this is the route. Always, we're going to start at that 30-minute free consultation. Always going to start at that 30-minute free consultation for you to get your feet wet. For nutritional supplements, as well as the green clean products, you are going to bookreneenow.com. You will get access to this link. It will show up and will go right to her calendar so that you can book time with her. We are working together on this project, and she is supporting me in that because That's her jam, and these other things are my jam. But I will be the one going over your lab work or your family member's lab work with you and what we need to develop a holistic body nutritional program. Okay. Next, how to get in contact with me and with Renee. One thing that I want to share is we will be hosting several different master classes coming up. Ideally, we're going to start at the first of the month. I have some travel, and so does Renee coming up, so the dates are not solidified yet. But our next classes are going to go over halting the fear after diagnosis, which I do have a question from the audience I'll share in a minute. We're going to have an entire master class on just the fear after diagnosis, what to do. The second, so you're in remission. Now what? I plan on writing a book one day on how the stress of being in remission can cause cancer. Unless you're Renee. I haven't met a lot of people like Renee who can be in remission. And Renee, on a scale of 0 to 10, if I've never asked you this question, I've always been curious, or maybe I have asked you this question, but are you open to sharing on a scale of 0 to 10, with 0 being no stress at all and 10 meaning you cannot sleep at night because you're nervous about getting cancer again? How would you rate yourself? No wrong answer.
Brutally honest, 0. I don't think about it because I have worked so hard to let any type of stress go because I know that's what triggers it, especially for me. And I used to be a ball of stress. So, and not to make light of this, but once you lose everything in a wildfire and you have to deal with high stress for like 5 years, nothing else matters. And I would love to do a master class on how to de-stress and how to learn to let go, because there really is nothing that we just can't control most of it. I think they say when you worry about something, only like less than 8% ever happens and comes true. So 92% of what we worry about just doesn't matter. But I've worked on it. It doesn't come natural, I don't think, to anybody. But I don't even think about it, Candace. And it was very scary when you go through it. I can't, that's something I will never ever forget, the days the different times I was told that I had cancer, and everything runs through your mind, but it's not a death wish anymore or a death sentence anymore, because it used to be. And mine 17 years ago. So I've been in remission. So, no, that's a very good question and a very honest, safe question, because I don't think many people can truly learn to let it go, but I have mastered it, and it's so peaceful, and you have joy. You have true joy that you're living every day to enjoy what you have. So.
Thank you for sharing. That was we didn't plan that question, so thank you for being honest, and thank you for sharing. So again, upcoming, we're going to be taking several of the things that we talked about and going in a little bit deeper on them. I also want to do a class on the truth of scans and the effects of chemotherapy. We're going to go into that because I know I've had several people reach out and say, "Hey, Candace, can you ask that question?" And I said, "Well, or can you answer this question?" And I said, "Well, I can, but I'd rather do an entire hour on it." So how do you get a hold of us? Here is my email, my Instagram and Facebook, and also Renee's email is here. Also, for those of my people with smartphones that didn't watch this on a smartphone, you can scan here. Oh, and I also wanted to share something that one of my Bible scholars shared with me is again, this is not meant for an entire Christian audience, but I am going to speak to that audience right now, is worship or worry. This is what one of my Bible scholars says. Worry is worship to the devil. Faith and trust is worship to God. So I know many, 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 many faith-believing, God-fearing people who are making physicians God right now.
Yeah.
And clearly I get to do a class on that because that's really burning on me right now. So anyway.
So Candace, I'm going to add on to what you had asked, because I think a big part why I don't worry is because I feel we are mastering how to survive cancer without the chemo and radiation. So I'm not afraid of it.
Mm.
So the fear of, even if it does come back, I know that there's so much that we can do together. What you and I have learned, build the immune system, you do your diet, all that stuff. And I believe that's why I don't have fear, and I do have strong faith, that if it does happen, it's meant to be, or it's meant to happen, and I'm supposed to learn from it. But knowing that you can survive it, and we have, the resources now
Mhm.
to do it, where
Yeah,
we
what
had
I'm
to make
hearing,
up the resources. We had to figure it out.
we had to pave the way. What I'm
Yeah.
hearing you say is you have such not only confidence, but you have done your research to trust alternatives. And because of that trust and that confidence, it's not a question for you anymore. It's like, you know what? I have built the processes
Yep.
and I'm comfortable with it, whatever happens. You're recession proof.
Yeah.
Yeah,
I like that. That's a good way to put it. Definitely. Yeah. Thank you for that question, because
you're
it,
welcome.
it, to me, to get everybody to that point, how cool would that be to
That's
have
the
that
goal here.
confidence?
That's what we're here for.
Yep.
That is the
100%.
intention of these classes.
Yep.
And one more thing, I'm going to get to two more slides and then we'll wrap it up. And then I do have a question from the audience is if you would love to follow me, I do have a podcast, a biblical related podcast. If you would like to follow that, this information will also go to your email address. And this is a Bible discussions where I do speak about several of the things that I spoke about here, but we're going to go in depth on faith and the word of God. If that interests you, that is here. And then also you're going to get my recipe for nice cream, which I told Renee about the other day. You guys, I actually have made this. It is so darn good. This is a very old picture from, no joke, 5 years ago that I pulled out of the ethers to show you a picture of this. This is why it looks really pixelated. But this is something that you can use, how Renee was mentioning, that high quality protein. You can sub collagen in here or even add it. But the intention is you're making a nice sweet treat for you that's filled with antioxidants that help free radicals, stimulate muscle recovery. You're going to need that in your treatment, plus protein that keeps you energized and healthy for treatment and away from sugar. So that is it for our presentation. I want to jump right into a question, and then Renee, I'll go over to you if you have any questions and we'll wrap up. One of the questions that I had from someone that registered, I won't say a name because I'm not sure if they want their name revealed, but I'll just say that the question was, so I've had cancer and I've already had surgery, I've already had chemotherapy, lost my hair. What would you say to someone that has a diagnosis and there's instantly fear and you jump right into treatment?
Mhm.
And what I want to say to this question is honestly, thank you for when you see this recording, when you sent me this question, that was the reason I created a masterclass on it, and we'll be hosting another one. But the first thing that I can say is this was it. This class was it. There's something I would imagine here that sparked your interest enough that you do know that there's an alternative. But let's say you didn't have access to this masterclass. Let's say you didn't have that wisdom. You don't have the trust and the confidence that Renee was mentioning. You don't have those things. Let's say that. The first thing that I can say is you have the diagnosis, ask for space. Your physician is going to say, you need to do it now. We got to cut open your body. We got to do it. You got to go. And there's going to be this energy. And what you're going to say is, the cancer didn't start yesterday. It's been growing. It's been there. 24 hours for yourself is not going to accelerate your cancer any more than however long it's been growing for you. Now, if we have an emergency situation, like the cancer all of a sudden has started pressing on a windpipe or the heart, which I have seen, Yes, we need some medical interventions immediately right away, but that doesn't mean you need chemotherapy, radiation, or even the surgery right away. That's why asking, okay, I need these immediate medical interventions like steroids and oxygen and other things like that, but taking the time before you make that decision to cut open your body. I don't think people realize how traumatizing to the body to cut through nerves, muscles, sometimes bone to get to cancer, and how devastating that is for the body to have to go through. It's like a shock.
Mhm.
So educate. The second thing I'll say, so first thing is you can ask for time. And your physician may say, no, you got to do it now. We need to make this decision now. And it's going to go fast and it's growing rapidly. And you have time. You have time to sit 24 to 48 hours to make your decision, just like buying a house. If the house was meant to be, I have bought a house before. I know what that's like. I've been house shopping before. If it was meant to be, then the house will be there in 48 hours. I don't care how many people have already put deposits in. The house will be there in 24 hours if I need to sit and think on it. Okay? The second thing that I'm going to say is if you have family in your life that can be there with you in the room that are going to help you with that stop, I need 24 to 48 hours, and help you with that advocacy, please take your family member into that meeting. If you don't have those family members, we have some work to do.
Yeah.
And that's probably what created a lot of this emotional turmoil that you could be in. I'm not making an assumption. I've seen it, and take someone with you so that you have that time. That's the quickest way I can answer this question.
Can I add on to it, Candace?
Yes, please.
Okay, so I had no family support. My husband, yes, but not so that's where the recordings come in. And I liked how you said you don't ask permission, you just go in and say, hey, I'm gonna record this. You just tell them what you're gonna do. So, but the other thing that I do want to touch base on, if you've already done, I mean, just the anesthesia, what it does to you, your brain and everything, you now need to start healing your body also. So that's where learning about what foods to eat, if, and we actually have a regiment of the different antioxidants and things you cannot take during chemo, if that's what you have been doing. But we need to start healing your body from that chemo. We need to start healing that body from the surgeries of what has happened. And that's where hydration comes in and proper protein comes in. And that's where let Candace read your blood work. I cannot state that enough because you could be extremely deficient in iron. I produce a lot of iron, so I never needed it. But normally when you have those types of surgeries, your iron is just depleted and you cannot heal. Your cells can't heal without proper iron. So work with Candace on your blood work, then please set an appointment with me and I will go through to help you pick the stuff that you need. One other website I do want to talk about, Candace, is the American Institute of Cancer Research. They are out of Washington, D.C., and if you need to do any research, they are wonderful for research. So, because everything Candace has been telling you, you can go there and they back it up 200%. So they talk a lot about preventative on there. So,
Good.
so yes. So
One,
yeah.
one, one thing I'll also add to it, it wasn't necessarily part of the question, but it leads into the second question that I received that wanted to be answered on the recording, was what do we do about nutrition? What do I do about my nutrition during treatment and after treatment? What does that look like? The physician says he's taking care of it.
Oh,
I
no.
just,
I'm sorry to laugh so hard. They have no clue. They have no clue.
So I want to share a quick example. I'll go high level and then I'll share an example. High level is just know that the physician, because they have education in one area. They may have interests in other areas, which is great. They may have a little bit of interest here and a little bit of interest there and a little bit, but they are specialized in one. That's why they're called a specialist. Okay. And their blinders are on because all they're focused on is giving you a treatment and watching a scan. Giving you a treatment, watching a scan. Imagine like like the horse jockeys when they're running a race. They partially blind the horses so they don't get distracted. They're wearing side goggles so they can't see. They're just on a mission. They're not going to deviate because they have the side goggle. That's your physician, and that's wonderful for the type of work that they're doing. I'm not at any way want to take away from that. They've studied that. Now the issue is when we want to look at the whole picture. Now that is high level what's going on. You want the whole picture. Your physician says they're looking at the whole picture, but they're not. They're in treatment protocol, treatment protocol, treatment protocol. Now, I'll give you an example. I met with a daughter. I was referred to by a friend of a friend. I don't even remember at this point. A word of mouth. And I was working with a daughter and ooh, sorry about that, y'all. Sorry. One moment.
So while Candace is doing that, you guys, medical doctors have typically they receive fewer than 20 hours of nutrition education to become a doctor. And I know that from experience. I have interviewed doctors. So yeah, I don't have to go on and on because it just infuriates me when they think they know what they're talking about when it comes to nutrition, and they just don't.
No, and I apologize. You're going to hear the dogs barking in the background. My alarm system is going off telling me that Prime is here. I had a patient and I reviewing her mom's blood work. I had permission from the mom. I didn't meet her mom. I was speaking specifically with her daughter. And I'm looking at the blood work, and then I asked a few more questions. I said, "Hey, I want you to go ask for these other labs. We really need to be looking at X, Y, and Z." Renee knows what's up. I'm like, I really what why have you been scanned for this for 4 months and I don't have 6 months? You don't have where are these labs? So I went and asked, they did go and ask the physician. The physician was agreeable to get those labs. And I'm looking at them now. I'm speaking to the daughter and the mom who has the cancer. And I said, well, you have been low in your H&H, your hematocrit and hemoglobin for, I think, I could be butchering this, but it could be, I think it was 3 or 4 months. And I said, so your mom is very tired. She's short of breath and she's just very tired, very, very low energy. And they haven't done anything. I don't see any iron supplements. I don't see any nutrition. She hasn't received any nutrition recommendation or a dietitian, but she's consistently low. So what happens is even if you are above the transfusion line, I'm not going to get into numbers right now because they don't matter at this point, but let's say the transfusion line is here. You have to be this low to get a blood transfusion. She was like right here for months, just above the line, teetering, dropped down a little bit, came back up, dropped down a little bit, come back up. So not consistently enough to get a blood transfusion. But the problem is her body was living without the saturation of iron and blood that she needed. So why are we gonna, she's exhausted. She can't do anything. She's short of breath. The doctor's like, oh, well, we could just give her this or do that. They're not actually treating it. So I'm looking at, okay, what's the diet that you have her on? And the daughter wanted to advocate for vegan. And I said, I'm going to put a pause on that. And we're not going to do that. And then I instituted some other protocols. By the way, again, I'm not a physician and I'm not a nurse practitioner, so I do not recommend, nor do I prescribe. I can share with you evidence-based practice that I have seen clinically that works and suggest. And what I suggested was a food and nutritional protocol as well as some alternatives to start getting her energy back up. We were able to get her energy back up and stabilize her H&H. So I'm not sure what it is now. I haven't seen her in a little while, but that's just one example of the blinders.
Yeah.
Yeah. So that was all the questions that we had. Renee, do you have anything that you want to add before we
No.
wrap up?
No, the biggest thing, be your own advocate, start learning. But, and this is where working with Candace and myself, we give, free consultations. You got to know what questions to ask. And you really don't know until you meet with us. So we can help you. And we are here to help 100%. So I just really appreciate, Candace, everything you've done. And I'm looking forward to this journey to help more people and to bring awareness.
Me too. Thank you so
Yeah.
much, everyone, for attending. If you have any questions, if something has stuck out to you, please share it with us. If something that Renee shared really stuck out in her story, please email her. Please share that. Same thing with me. If something that I shared stuck out to you that really, really just hit your heart, or you have a question, please feel free to reach out to us, and we'll see you on the next masterclass. Thank you.
Good. Thanks, everyone.
Bye.
Bye.